is freedom, which can be defined as the absence of government restraint on our lives, and this can be applied to the fact that being sick or old doesn't affect one's potential or worth, which is also known as self-actualization. And Stephen Hawking is a scientist who is an example of a sick person who has exceeded well beyond society's expectations of him. He has a motor neuron disease related to ALS, also known as Lou Gehrig's disease, in which he is almost entirely paralyzed and communicates through a speech-generating device. And he was first diagnosed at age 21, and he's 71 now. However, despite what many would call his limitations, he is still active in science and research. He has written many scientific books. He's been awarded America's highest civilian honor, the Presidential Medal of Freedom in 2009, and the Russian Fundamental Physics Prize in 2012 for his contributions to physics. And all these awards were for work done while his deterioration continued, in which he now controls his communication device with movements of his cheek muscles at a rate of about 1 word per minute.
In addition, age does not necessarily correlate with a person's potential or social worth. When Nelson Mandela became the first black president of South Africa, he was 76 years old. He was 79 when he won the Nobel Peace Prize, and 80 when he wrote his first book, 86 when he wrote his second book, and 87 when he wrote his third book. In the span of 10 years, he did more than the average person does in their whole lifetime. Older people can still achieve great things, and even if they don't, they work their whole lives. They're probably someone's grandmother, someone's father, someone's mother, and they have value. Doctors cannot accurately measure a person's social worth. If they do, this is medical paternalism, and it takes away patients' freedom and limits the chance for them to reach self-actualization. Thank you.
Just a question. So who has a longer life expectancy, an 80-year-old or a 14-year-old?
A 14-year-old, but that doesn't necessarily mean that you're going to do more with the years that you have.
Correct, but you're saying that an 80-year-old hasn't lived out their life, but a 14-year-old has?
It's all based on an individual.
Okay. And you're also, you said those examples about Nelson Mandela, but we have millions of people in America. Those are only just 2 examples. So, like, is that relevant for everybody? Is that going to happen to everybody?
Shouldn't we save the few individuals that go far above what anyone else does?
Well, we're not killing them. We're decreasing, like, fetal care.
Well, in your definition of healthcare, you never mentioned that you're addressing fetal care and not healthcare in general.
That was mentioned.
Are you sure? Can you repeat your definition?
Yeah.
It's word for word. Word for word, please.
Okay. Prevention, treatment, management of illness, and the promotion of mental and physical well-being through the serious services offered by the medical and allied health professions. In other words, it's the purpose of life to extend care. Purpose of healthcare is to extend one's life and to end fetal care.
Okay. Was that in the definition you gave us?
Yeah, but we mentioned it too earlier.
Okay.
Doesn't in extending one's life mean providing care?
Well, would you provide care to someone who's terminally ill and they have no chance of surviving?
Well, you shouldn't deny them care. Like, I have another example of a person named Randy Couch who is diagnosed with pancreatic cancer, which is terminal. He had 36 months to live. But he managed to give this great lecture at Carnegie Mellon that inspired so many other people.
That's only 3 examples for millions of people. That's not
3 examples that influence so many other people.
Oh, okay. Okay. So, do you think that we're treating?
Stop.
Do you think that
We will both be presenting the value of sanctity of life. Sanctity of life as a value standard is based on the premise that human life is uniquely sacred and precious. Immanuel Kant suggests that the categorical imperative basically says, if it's okay for me to do it, it has to be okay for you to do it. And it also states the golden rule, which is treat each other the way we want to be treated. Based on both of these principles, we concluded that killing is bad. Categorical imperative also says that it is wrong for us to consider ourselves ahead of or better than others, and we must put our duty to others first. We should treat them no worse than we treat ourselves. Every human being has value that transcends all human capacity to count or measure. Sanctity of life is a moral conviction that should not be weakened, but it is when we view humans in a lesser state, such as weak, disabled, or poor. We sometimes decrease the value of human beings. Doctors might give false prognoses when it comes to how much time patients have left to live once being diagnosed with fatal illnesses. This can mean that a patient receives the length of time they have to live, but do not live as long as the doctor said that they might. The Mayo Clinic cited a study in which survival predictions were made for 468 patients in hospice programs. 20% of the predictions were accurate, but 63% of the predictions were too optimistic. Another study also involved patients receiving home hospice care. The median survival estimate doctors offered the patients was 90 days, but the actual median survival was 24 days. Researchers have found that doctors tend to overestimate patient survival by a factor of 3 to 5.
Furthermore, human life is precious. How can we not help people if we can with health care? Even if you are old or sick, your life means something, and no one in our society is unnecessary. Human life is basis for other values as well, such as freedom, equality, and justice. And taking away health care from anyone of any age could deny their freedom of how they choose to die or to continue living. The Declaration of Independence and Social Contract also state that everyone has the right to life, liberty, property, and the pursuit of happiness, and denying care could violate the right to life, impartiality, liberty, and happiness. You can't discriminate people based on age, because how is that different from discriminating by race, ethnicity, or sex? You have to treat all patients equally. And to wrap it up, is the Hippocratic Oath, which states that every medical doctor takes states that treat the sick to best of one's ability. That statement is not discriminatory towards age or life expectancy. Not treating patients based on age violates that.
All right. So you mentioned that we have an obligation to treat everyone always.
Yes.
So what can be gained from giving the dying futile and unimaginably expensive and also perhaps painful end-of-life care?
Because even if you think it's futile, you don't know exactly how long the patient can live after that treatment. You might think that they might only live a few more months, but to them that few more months can be happiness for them, which they do have the right to. And you could be wrong. Doctors could be wrong as to how long the patient will live after treatment.
Okay, isn't it better to treat a 14-year-old who has a lot of years ahead instead of an 80-year-old who has already had a sort of...
Well, sure, but it could also be circumstantial. What if the 14-year-old has terminal cancer? He could die any day. What if the 80-year-old just has a benign sickness who could be treated and could live another 10 years?
If you had an either-or choice, which one would you choose?
It's completely circumstantial. You can't base who you're going to treat on their age.
All right, so if we were valuing individuals over the majority, because like those are individuals, those examples, as opposed to the majority, there are a lot of young people who need treatment, and should we only give health care to the wealthy?
No.
Yes. So like if we don't discriminate by age, then right now naturally we discriminate by wealth because only certain people can pay for health care.
It's true that only certain people can really pay for it with their own money, but that doesn't mean that they shouldn't be treated because they're citizens just like everybody else, and why should they be denied care?
Okay. And then all right, what if the patient is a vegetable or barely conscious over their morphine? Is it worth giving them treatment? Isn't there a point where we say we have to stop?
That could also be circumstantial, but that's also a decision that's left on the family and not the doctor. You're supposed to be prolonging life, and even if you're prolonging it as a vegetable, they're still alive.
Well, what if that means not giving medical care to the young?
Stop.
Sorry.
First off, I would like to say that in the affirmative definition of their entire definition of rationing healthcare, fetal care was never mentioned at all. Doesn't matter. It wasn't even mentioned as a definition of fetal care. It wasn't mentioned at all. The affirmative side repeatedly stated facts that referred to the rate of the expectancy rates of living, and all of these facts are most likely false. According to the New York Times, 20% of expectancy rates are accurate, and these expectancy rates are updated over time and are changing daily. And all of their cross-examination questions were circumstantial. How can we decide as a group of 10 people decide who gets treatment for a specific case? We can't decide that. That depends completely on the circumstance of everyone else and what all doctors decide. We can't decide if a 14-year-old who needs some treatment should get the treatment or not. And then everyone responds differently to medications. So you can't just, again, it's all circumstantial.
Based on the values of freedom, self-actualization, and sanctity of life, we cannot discriminate against age. How are we as people to be the judge of how another one decides to live their life? We cannot judge the quality of someone's life since it is not our life. In a literary example, stuck in neutral, a boy with cerebral palsy is completely confident and intelligent within his own mind, but his father decides that he should kill him because he thinks that he does not have a good quality of life. When this boy is completely confident and knows exactly what's going on, we need to, in the Hippocratic Oath, it says that every medical doctor should treat the sick to the best of one's ability. How can we say that treating a person to the best of their ability is based on age?
Let's start off with their first contention where they talk about freedom, and they basically mention this idea that age discrimination is inherently bad, but there's a problem with their logic. Age discrimination is distinctly different from something like racial discrimination. When we discriminate on the basis of race, we're targeting a specific group of individuals, but when we discriminate by age, everyone is being targeted. Everyone ages, everyone gets older, everyone's going to have their time as an elderly person. So at the point where you're discriminating against everyone in the United States, you're discriminating against no one. That's why age discrimination is non-existent. Let's look to our second response, where you're going to turn this argument about age discrimination against them. Because essentially, in the status quo, we're discriminating by age. The Santa Clara University tells you that we spend $9,000 per elderly person, whereas we only spend $900 per child. At that point, we're disproportionately allocating healthcare resources to the elderly solely on the basis of age. So younger people are getting hurt, and we're discriminating by the basis of age in the status quo. Now let's move on to their second point, where they talk about the sanctity of life, and they essentially say lives are sacred, that's why we have to preserve them. But remember, the only life we're taking away are lives that aren't meant to live in the first place. We're only taking away taking away this extension of care. We're making sure that people can only live their natural life expectancy. And remember that these are lives not worth living. The National Alliance on Mental Illness tells you that 6.5 million people aged 65 years or older are depressed because of their weakened state. At the point where 80% of Americans are dying in institutions, but 85% want to die at home, these people are being tethered to their life respirators and are tethered to these hospital beds, and they want to die at home. These people are willing to die, they don't want to live their lives out, and at that point, you're just extending life that isn't meant to exist.
Okay. Rationing healthcare is not discrimination. Everyone ages eventually. It is just limiting fetal care on a population of chronically ill who cost $66.8 billion per year in their last 2 years of life. Our Medicare system is headed towards bankruptcy, and we need to better ration our extension of life treatment. 30% of Medicare costs are given to the elderly in their last years of life, which are costs we can eliminate through better rationing. Utilitarianism is the belief that we should maximize happiness, and it is furthered by rationing. Caregivers of the chronically ill, which are 34 million Americans, out of them, 91% report depression. Rationing healthcare is not killing, it is lessening futile care and providing more funds for life extension treatments and more funds for education for our children. By rationing healthcare, we can give all people the greatest chance that they can to live a full and happy life. Thank you.
Okay. Okay, so that concludes the arguments by both teams. If the sophomores would take a minute to complete your ballots. I'd like you to please, sophomores, if you're in Dr. D's class, if you could put next to your name a D, and if you're in Mrs. McKeever's class, if you could put an M next to your name so I can give those back to the right teachers. And so as soon as you have finished, you may go back to your